Welcome to the Borno Health Update. I'm your host, Ibrahim Amarawa. On this program, we track the advancements in the healthcare under Governor Zulum's administration. Today, we focus on the transformative efforts spearheaded by the Honorable Commissioner for Health and Human Services, Professor Baba Malam Gana, who is driving innovations and resilience across our healthcare systems. Pregnancy is a physiological phenomenon and no man should die from it. This powerful statement came from the Honorable Commissioner for Health as he outlined the Borno State government's multifaceted approach to improving maternal health. He spoke at the plug-up ceremony for free vesico-vaginal fistula refers to rehabilitation, a vital initiative supported by the First Bank PLC.
As outlined today, VVF occurs because of poor obstetric care. This poor obstetric care, as enumerated before, can be due to many reasons. In Borno State, we have taken maternal health very seriously. At any point in time, we have 400,000 pregnant women in Borno State. And we provide them with free medical care. We give them free maternal drugs, and also they come to deliver, it's free, and if they cannot deliver through the birth canal, then we offer them cesarean section. This is a game changer. If you can provide immediate cesarean section, prolonged labor will not be there, and VVF will not be there. I want to reassure you that in Domboa, we recently commissioned a brand new general hospital in which cesarean section is being offered, so that will prevent complications such as, vesico-vaginal fistula. Borno State is the third highest in maternal death in Nigeria. Kano is number 1, followed by Katsina. Borno is third with 13 local government areas. This safer birth bundle of care is already operating in this very institution, and our initial results have shown that we're saving lives, the lives of women. We're saving newborns because, for example, before safer birth bundle of care, there was 117 fresh stillbirths in this hospital alone, but after SBBC, it dropped to only 11. And in this hospital, since SBBC was introduced, we saved 97 newborns. So these are innovative programs aimed at saving lives of women and newborns and avoiding complications such as vesico-vaginal fistula. We're also gone innovative. Our midwives are now being trained to do ultrasound scans. This means that if a midwife scans a pregnant woman and the placenta is abnormally placed, then she will quickly refer this woman to have her operation or delivery in a center where operation is possibly done. No attempt should be done in primary health care. 69 maternal deaths were recorded prior to SBBC, but after SBBC it's dropped to 30. But This is too much. We feel that is too much. No woman should die through pregnancy. We are also fully engaged in this state with the maternal mortality reduction innovative initiative of the federal government. We are also fully on board with the postpartum hemorrhage program to save our women dying through loss of blood when they come to give birth. All these were done by His Excellency to save lives and prevent complications such as VVF. We also, His Excellency has launched the SAMSAS, emergency transportation, because poverty is high. Not everybody owns a car in the state. Therefore, in the middle of the night, there will not be NAPEPs are available. And some women, even if they want to come to hospital, they don't have the means of transportation. As a result, the emergency ambulance system has got a toll-free number. And this number, you can dial it, we can answer it in our call center, even if you don't have any credit in your, on your phone. And the ambulance will come to your house, pick the woman, and deliver the woman to a hospital.
While appreciating the First Bank for their generous gesture, the commissioner highlighted the giant stride taken by the present administration in addressing the shortage of health professionals and fast-tracking healthcare infrastructure improvements across the state.
Borno at present has got about 50 general hospitals, and all these hospitals have got theaters. We have commissioned last year alone, and beginning of this year, 8 brand new general hospitals, including Damboa and Gajiram. So this is very crucial, and because Borno has had this insurgency, we are also working very hard to increase the number of midwives and nurses being graduated. We have opened College of Nursing in Mongono and in Goza, and the College of Nursing here, you can see some of the students. We've increased their numbers. So in the next 1 or 2 years, Borno State alone will be producing, graduating 1,000, more than 1,000 nurses and midwives. This is thanks to His Excellency for this effort, and we are also about to commission our brand new state teaching hospital. It's named after Sir Kashim Ibrahim Teaching Hospital. It's state-of-the-art. This hospital will reverse all the medical tourism that is taking place in this part of the state and this part of the country. It is going to be truly a game-changing hospital. As enumerated earlier, First Bank is the first, for there is no other bank we are aware of that has taken on the burden of our women in terms of vesico-vaginal fistula and extended this assistance from Katsina to Kano, Jigawa, Plateau, Benue, Zamfara, Sokoto, and Borno State being the first in the Northeast. We are immensely grateful for your consideration. There are many more other states in Nigeria, but you decided to bring this assistance to us in Borno State. We will never forget this.
Similarly, the executive director of the First Bank Nigerian PLC, Alhaji Shehu Aliyu, represented by group head for the Northeast, Mohammed Abdul Qadir, affirmed that the bank's commitment goes beyond financial services. He noted that the decision to sponsor life-changing surgeries and rehabilitation for patients in Borno State is part of a broader corporate social responsibility. This initiative mirrors similar efforts in states such as Katsina, Kano, Jigawa, Zamfara, and Plateau State.
Our presence here in Borno State reflects our deep commitment to the communities we serve and our solidarity with women whose courage continues to inspire us. For us at First Bank, banking goes beyond just financial services. It is about creating impact, promoting inclusion, and advancing shared humanity. This initiative is part of our ongoing efforts to restore dignity and hope to survivors of vaginal fistula across Sokoto, Kano, Jigawa, Plateau, and Katsina states. We have supported more than 300 women with life-changing surgeries, rehabilitations, and empowerment opportunities. VVF remains a major health and social challenge, causing not only physical suffering, but also emotional and economic hardship. It is a burden no woman should carry alone. At First Bank, we consider restoring dignity not as a charity, but as our responsibility. Today's engagement deepens our commitment to providing holistic support from medical care to awareness, prevention, reintegration. We are proud to work with government institutions, medical professionals, traditional leaders, and partner organizations to ensure survivors receive the comprehensive care they deserve. As we strengthen our community impact, we reaffirm a simple truth. When we empower women, we empower families.
In their goodwill messages, the governor's advisor on health matters, Dr. Abubakar Hassan, and the district head of Damboa, who is also serves as the Borno Emirates focal person on health, Alhaji Zannalo Almaina, highlighted the devastating impact of VVF on women's lives. They praised the visionary leadership of Governor Zulum and the Commissioner for Health for fundamentally transforming the narrative in the healthcare sector.
You have heard all about the devastating physical and social effects of vaginal fistula. All I want to add is that VVF is a result of what the Honorable Commissioner is fond of calling a physiological event, mostly here. That is pregnancy. And if pregnancy is not a disease, why should it result in a disease condition? Of course, for those of us who are in the medical profession, we know that women can have VVF even in their 70s, but those ones are minuscule and we hardly get it here. But due to our demography, the African demography, especially in Nigeria, the 16 to 30 age group forms more than 60%. And our women of childbearing age are also the largest part of the female population. And then when you come to our geographic area, not demographic now, and the peculiarities of our society and social systems, VVF becomes a very big problem. and sometimes it is neglected. And that is why it's part of the attention that we are giving for the vulnerable group. Ladies and gentlemen, in our quest, and when I say our, I'm talking holistic, from the federal level down to the primary health care, local government level. The in thing now is about maternal and child health. So VVF is one of the problems in maternal health, and it is preventable. As the advisor to His Excellency on health matters, you can be rest assured that this gesture, although His Excellency knows it, I will tell him I was physically present. So the health workers, it is our obligation to do what we are paid to do and what we are supposed to do. But we are very grateful to First Bank for this exemplary gesture.
His Excellency, the 10-point agenda on health. And you know, the coming of Professor Baba Malangana, a lot of changes have been made in the health sector. We missed him for almost 40-something years. When I met him, he could not even recognize me. I said, Doctor, you have forgotten me. Because he has become an Oyibo man. So now, there are a lot of changes. A lot of changes. Also, Professor Baba Malangana and His Excellency has made the health sector a different. College of Nursing in Goza, College of Nursing in Monguno, College of, is it dentist? Dental hospital in Biu. So you find there are a lot of changes in the health sector, a lot of development in the health sector. Also, let's have a community engagement. Let us start from the bottom-top approach, because we have 8 emirates in Borno State. We have Borno Emirate, we have Dikwa Emirate, we have Bama Emirate, we have Askira Uba, we have Goza, we have Shani, we have Biu, and Uba. So we have 8 emirates. In fact, we have to have a very collaboration with these emirates and their districts, so that we create awareness on VVF. And the banker, it's not much to go around all these emirates and create awareness, make an advocacy to the emirs. And also we have 183 districts across the state.
Earlier, the State Secretary of Medical Women Association, Borno State Chapter, Dr. Aisha Kyari, highlighted the devastating effects of VVF which can cause a woman to lose her dignity, income, and livelihood, called on major stakeholders to intensify awareness, emphasizing that VVF is preventable and curable.
As a medical woman in obstetrics and gynecology, I have seen firsthand the devastating impact of obstetric fistula. I have met women who labored for 2 or 3 days at home without skilled assistance. I have seen the physical exhaustion, the stillbirths, and often accompany prolonged obstructed labor, and the silent tears that follows when the joy of childbirth turns into prolonged suffering. Vesicovaginal fistula is not merely a clinical diagnosis. It represents failure of timely obstetric care and breakdown somewhere along the chain of maternal health services. However, in our settings, the overwhelming majority of cases are obstetric causes, arising from prolonged obstructed labor without timely cesarean delivery. From a medical standpoint, prolonged pressure of the fetal head against the maternal pelvis compromises blood supply to soft tissue. Tissue necrosis occurs, and within days, a fistulous tract develops. A fistulous tract thereafter develops. Often by the time the fistula forms, the baby has already been lost. This adds profound emotional trauma to physical injury. Beyond urinary leakage, many of these women suffer from severe vaginal scarring, reduced bladder capacity, amenorrhea, and infertility. In some cases, nerve injury leading to foot drop. This underscores why strengthening referral system, transportation network, and facility readiness is essential. It is therefore commendable that Borno State has invested in free ambulance services, which directly reduces the second delay, the delay in reaching care. As a medical woman in obstetrics and gynecology, I can confidently say that timely transportation during obstructed labor can mean the difference between a safe delivery and a lifetime injury.
In an interview following the program, the commissioner further commended Governor Zulum for his comprehensive and multi-pronged strategy to combat maternal mortality in the state. Thank you for joining us for this edition of the Borno Health Update. Stay tuned for next week's report, where we'll explore more innovations transforming our healthcare sector. This is Ibrahim Amarawa, reminding you health is wealth, and Borno is on the rise.